Hello, my name is Ajan and I did an elective placement in Royal Derby Hospital, and this presentation I'm gonna talk about that. My placement dates are, you can see here, 9th of June to 7th of July. My consultant name is Sumi Abdul. About me, my name is, as I said, Ece Ant. I'm a 5th grade, almost 6th grade medical student at Manisa Cerrahpaşa University in Turkey. I completed my elective placement at Royal Derby Hospital and it lasted 4 weeks. Actually, it was 5, but then I had some problems with my school and I ended up with 4 weeks. So what is elective placement? Elective placement is a period of time that medical students and healthcare students can do an observation, gain practical skills, and had opportunity to learn healthcare system in their country or another country. Students are arranged by themselves and like they lasted 4 to 10 weeks, but sometimes 12 weeks in other universities. Why I wanted to do elective placement in the UK. I'm planning to work in the UK after my graduation, so I want to see the main differences of our health system and their health system, and also I want to see the daily life in the UK, about like friendships, daily things that they do. And also I want to develop my speaking skills because it is like the best way you can develop your language speaking skills in the native with the natives, and it's a good opportunity to do that. And of course observe doctor patient relationships. To work there, I need to take some exams like PLEP 1 and PLEP 2, and PLEP 1 is more based on theoretical knowledge, and PLEP 2 is based on speaking skills, communication skills, and this is the best way you can learn that doctor and patient relationship in the clinics, and that's why I want to do this is the main reason, almost the main reason I want to do that. And why obstetrics and gynae? Because I had some gynecological problems since very young age, and I spent more time in gynecology clinics, and women health I'm interested in because I'm woman. That's why I want to do in the obstetrics and gynae. I had plans to be a specialist in obstetrics and gynae. How I found Royal Derby Hospital. So I have 2 friends which they did their elective placement in Birmingham. They really assisted me to arrange my elective placement, and they told me that I need to send emails to consultants or consultant secretaries, and the best way to find it, of course, search on Google and NHS website. So I found the emails from mostly NHS websites, but there are some private websites also. You can find that emails, and I send around 200 emails, mostly to gynecology and obstetrics, but to raise my chance I send another departments also, and I'm so glad that I ended up with gynecology and obstetrics department, because the main department I wanted is that. So thanks to Mr. Abdul to accepted me. So you can see some pictures from Derby. The first one is where I accommodated. It's called Manor Park Court. The school told me that there is a place that you can stay called Manor Park Court, and I emailed them and then arranged the accommodation. The second one is from city center, and the third one is also from city center. About Royal Derby Hospital, you can see some photos here. The first one is inside the building, the entrance of it, and the next one is a clinic, and you can see the main entrance here and the little garden. Royal Derby Hospital is large modern teaching hospital located in Derby, England, and part of University Hospitals of Derby and Burton NHS Foundation Trust. The hospital has over 1,000 beds and modern surgical theatres. It includes the largest emergency department in the region. It's a major teaching site for University of Nottingham Medical School, hosts a clinical skill center and simulation facilities for students. There are a lot of students from Nottingham and doing their rotations in the Royal Derby Hospital. Offers specialist care in areas such as cancer, cardiology and women's health, known for its advanced laparoscopic and robotic surgery units. You can see all the departments and services in Royal Derby Hospitals. I'm not going to read all of them, but if you click on them, you can go to their NHS website. Obstetrics and gynecology. You can see obstetrics units and gynecology units. I've been all of them except Urogyne. Unfortunately, I've been in there for 2 times, but once there was another medical student, and the other one there is no consultant there, so I couldn't attend the clinic. But other things, I was in there. Here is my rotation. I've been in theatres, mostly in TLH BSOs or cesarean sections. I was in gynecology clinics like endometriosis or gynecological oncology. I've been in MDT, multidisciplinary team. There are some doctors from different specialty like oncology, gynecology, pathology, histology, like this, and they arranged patients' treatments. Hysteroscopy clinic, colposcopy clinic, fetal medicine. Fetal medicine was my favorite. And I also into theaters. Fetal medicine, I said. Antenatal clinic, labor ward. Labor ward is a little chaotic, but still good. Pregnancy and gynecology assessment units and fertility clinics. I really like fertility clinics as well. Laparoscopic hysterectomy training at Delta Center. You can see gynecology theater entrance, and this is a photo from fetal medicine clinic. This is another clinic photo. This is pregnancy assessment unit. And here is Mr. Abdul. Mr. Abdul is a consultant, obstetrics and gynecology consultant since 2006. He's known as keyhole surgeries nationally, and his teaching keyhole surgeries nationally and internationally, like me. And he is also founder and director of Delta. What I've learned, I've been in different clinics and had opportunity to see different methods of examination of the patients, doctor-patient communication. So there are some patients and also doctors from different countries, and it affected their speakings and communications also. So it is really good for me to develop my understanding and listening skills. Again, patient examination, as I mentioned. As I said, like, I'm planning to work in the UK after my graduation. I need to see NHS health system. It is so different than my country, actually. I'm not gonna say it's better or worse, because just simply different. I think it's better for doctors, to be honest, and worse for patients. For doctors, it's good because everything is so planned and easy to manage, I'm gonna say. Worse for patients, because some patients told me that they need to wait up to 6 months to get an appointment, and I think it must be difficult for them. So I had opportunity to see different surgery techniques. It's also good for my future career and theater organization. Theater organization is one of the main differences from my country, because every theater has hand washing areas, and these sterilized instruments are in the theater. Like they have some small room inside the theater, and the instruments are in there. But in Turkey, there's just one big main room, as I know. I don't want to give wrong information, but as I known, there is a big room that all instruments are there, and the doctors and technicians are take from there. But again, as I know, as I saw in my hospital, my cultural social experience, I work with people from different countries, ethnic backgrounds, and I was scared that maybe some racism or discrimination can happen. And of course there's no racism at all, because everybody is from another country. But of course there's like British ones as well, but they're all so welcoming and so kind to everyone. It was so good. I was so happy there, because they behaved me so kind, and they always try to teach me something. Like they always ask me, did you see this, have you been in there before? And I said no or yes. They always willing to teach me and show me some things. They're so supportive. Do I recommend it? Yes. It was an eye-opening experience, and I believe every medical or healthcare student should do that, either in their country or another country. I think another country is better, because it helps more to open your eyes, open your vision, because it's different cultures, different system, and maybe I believe that it's better for your future career. And again, it really helped me to clear my mind and like build my future career. It will affect it. I'm so sure about it. You can see these photos are from total laparoscopic hysterectomy workshop at Delta Center. As I said, Mr. Abdul is director and founder of Delta Center. He and his team give courses, workshops, masterclass about keyhole surgeries all over the world. You can attend it. If you're from another country, you can attend online courses. You should go to their website, Delta Center, and also YouTube channel. So you can see Delta Centers and the models. We did sutures with these models. Like you watch surgery in theaters, like you thought that it's easy, but when you try to do sutures with the instruments, it is way complicated than you thought. But it was fun, and I want to say thank you to Mr. Abdul to give that opportunity to me. And thank you for watching this presentation. I hope it will be helpful for your elective placement journey. Thank you again.